The Advanced Access Bundle is a series of improvements that we developed with our collaboration with our IHI partners. And we started with some small improvement teams who learned about different changes that might improve access. And we tested those, and we found some encouraging results with some of the small changes. But we realized quickly that if we did not combine these changes together into a bundle of improvements, we would not see consistent, significant improvement in access to care for our patients.
At one time, you have to call at 7 a.m. in the morning to get an appointment. And sometimes you could wait on that phone for 45 minutes, and by that time is up, you would get all the appointments were booked. It's very frustrating. What I would have to do is end up going to the ER room and get a medication there, be it for my high blood pressure or my pain medication or whatever was going on.
With Advanced Access, we looked at examining what was the major complaints of our patients coming to the health center, and their major complaint was access to their providers. So we looked at ways that we would change the template or the roster so we could have equal availability for all patients coming to the health center.
We made changes to our templates, which previously we set them up to allow for different types of patients to be scheduled at different times. We went away from that completely. There's no reservations of appointments for any particular group.
Through a lot of the efforts through Advanced Access changes, we've been able to greatly improve access for patients to their doctor, as well as having increased continuity of care. There's a variety of ways that happened. One really important way was just through the appointments and limiting patients really to only see their primary care physician for, in my case as a pediatrician, well-child visits. This is what patients want. They want to be able to see their doctor, and as a physician, frankly, it makes my job easier, more rewarding, and achievable.
It did involve a lot of different staff, so providers, nursing staff, our medical assistants in clinic, as well as our health home team, and it involved our centralized appointment unit. It also involved our health information management staff, otherwise known as medical record staff, who we leveraged to actually support making appointments for primary care.
We introduced an LVN to the care team as well as an RN, and we started examining what role could the RN play to assist the provider to maximize a patient's care. So therefore, an RN may be doing a pre-visit screening of the patient on a telephone call before they came in, ordering labs, populating their medical record with information before they came in and saw the provider.
One of the precepts of our Advanced Access was having people work to the highest level of their licensure. It allows us to cover a patient panel that is very large, and if we tried to do it all, we would be overwhelmed and we wouldn't succeed. But as being part of an effective, cohesive health team, it really allows us to give patients the care that they need and want.
I don't have to worry about getting up at 7 a.m. and call during the day, and I can see my doctor a lot of times within a week.
I think the biggest lesson learned was that it takes more than just one change. It takes a series of changes to improve access. So it really has to be applied across the clinic so that all the patients are experiencing that improved access with their own provider.